We are really excited to share with you the vision for the Inova Center for Personalized Health. For many years, this campus has had a very inward-looking focus as the former occupant, first Mobil Corporation and then ExxonMobil, really went out of their way to make sure that nobody knew that they were here. And I was joking with some folks before. A lot of folks did know ExxonMobil was here, and that was very intentional. But that's really not the case anymore, and that's certainly not our objective. We want people to know that we're here because we think we're an important part of the Fairfax County and the Northern Virginia community. We're making a significant investment, and importantly, this isn't just about Inova, it's really about the community and applying the latest innovations to improve the health and quality of life of our citizens here in Fairfax County, Northern Virginia, and the greater Washington, D.C. area. Tonight, I want to begin with a brief overview of Inova's presence in the community and why we purchased this property, what's been happening here since then, and the tremendous potential for community benefit that we see in the years ahead. So I'm going to talk a little bit about Inova, and then we'll talk specifically about the existing property and what we plan to put on the existing buildings, and then we're going to talk about some of the programs and then the future ahead. I also want to bring, I will bring a little bit later, a few of our doctors to discuss the Shark Cancer Institute, how we're leveraging genomics to predict and diagnose and treat disease, and what this campus and our vision will mean to you and, importantly, your loved ones. Very importantly, we see this really as the beginning of an ongoing conversation that we plan to have with the community about the future of this property. We have invited more than 30 neighborhood and community organizations tonight, and we'll be talking even more in the months ahead about the plans for this property and what we want to do long term as part of the Inova Center for Personalized Health. So first, let me just start with a little bit of a reminder of who Inova is. Inova really is more than the flagship hospital across the street. The Inova Fairfax Medical Campus across the street is a flagship hospital. It is our academic medical center. But we also have 5 other nationally recognized hospitals: Alexandria Hospital, Mount Vernon Hospital, Fair Oaks Hospital, Loudoun Hospital, and our Women's Hospital. We have more than 50 clinics, urgent care, and other healthcare centers in the community. We have more than 17,000 employees. We're actually the largest private sector employer in Fairfax County and in Northern Virginia. Our doctors and nurses responded to more than 400,000 emergency room visits, and we had more than 100,000 patient admissions last year. Nearly 20,000 babies. My wife had 4 babies that were born at Fairfax, but 20,000 babies were born at an Inova facility last year. And just as a comparison, that's actually larger than the entire student enrollment for the city of Alexandria, and also larger than the population in the town of Vienna. So we deliver a lot of babies, and I'm sure a lot of folks here have had children delivered at our hospitals. Probably most importantly, we provided over $300 million last year in community benefit, which is uncompensated or charity care, research, education, and other benefits. We are the community health safety net within Fairfax County. So part of our obligation is around research, it's around medical education, health education, and also ensuring that those who don't have insurance, they have a way to get health care and afford the opportunity to do so. So again, we are a very important asset within our community. So let me talk for a little bit why we're here and why we acquired this property. You know, across the country and around the world, I don't need to tell you this, but healthcare is really changing. And as technology has advanced, and science has evolved, healthcare has as well. Healthcare used to be really a reactive transactional system. People got sick, they went to the doctor, and if they were lucky, they were healed and sent on their way until the next time. Today, we're really learning that in some cases, we can identify what triggers a disease: a person's genes, their lifestyle, their environment, diet, or some combination of all those. And knowing what causes a disease helps us to be able to better predict who might be at risk for getting a disease. And importantly, if we can predict disease, we can actually find ways to prevent disease. And that's certainly the goal, to keep people healthy in the first place. And if they do get sick, to catch that disease so early on that we can treat it effectively. Our focus, first and foremost, is on improving the human condition. And if you're a child born today, our goal is to help you stay healthy for your entire life. And if you do get sick, to make sure that we provide you with the right treatment and therapy based on who you are as an individual. And that's really the whole emphasis behind personalized health and precision medicine. To do that, we're expanding access to genetic testing, once available only to those who could pay top dollar, but that's no longer the case. A great example of how we're democratizing genomics and making it available to everyone within our community is our MediMap test. And this is a genetic test that combines pharmacology and genetics that can tell you how you will respond to certain medications. We can tell you if you're going to metabolize a certain medication well or not. We can also tell you, very importantly, if there's toxicity around that medication, because you don't want to take a medication if it's going to hurt you. So this is the great work that we've been doing in the area of genetics and genomics here at Inova. Very importantly, this information can guide individual decisions around medication choice and dosage and make sure that the drug is effective the first time. We're now offering this test at no cost to all babies born at all Inova hospitals, giving them information today that could save their lives tomorrow. And that's very important to get those tests early on so you don't take drugs that can hurt you later in life. This is just one of the many ways that we're democratizing personalized health for everybody within our community here in Fairfax County and Northern Virginia. And you're going to hear a lot more about this in a few minutes from Dr. John Deacon, who's with us tonight, who leads the Inova Translational Medicine Institute. Let me tell you just a quick story to give you an example of this. Our CEO, Knox Singleton, who's retiring, some of you may know him. He had lymphoma about 20 years ago, and he had stage 4 lymphoma. And before that, 20 years before that, his mother had lymphoma as well. And his mother was given, I think he said, 3 therapeutics, and she survived her lymphoma, even though it was stage 4. Knox obviously is with us today. He survived his lymphoma as well. He was given the exact same 3, I believe, therapeutics, and they gave him a 4th drug. And interestingly, this is around 2000. They thought that 4th drug was going to be the drug that would ensure his cancer would either get to remission or be cured. As it turned out, after we mapped the human genome in 2003 and the advances in science and technology, today we know that we would never give him that drug, because today we know with certainty that that drug was not effective. So why is that important? Because, well, we were giving him a drug, as he liked to say, that cost a lot of money, that had no efficacy whatsoever for him. That drug also had some side effects. So again, those are the advances. That's what it means when we talk about precision medicine and the great advances in science that are taking place today, giving people the right drugs, the right treatments based on the disease that they have. They're very specific to the disease they have. And we're fortunate that Knox obviously is still with us today and the CEO of the Inova Healthcare System. So again, that's just a little bit of a personal story. So let me talk for a little bit about what we're doing with the existing footprint on the campus. So we came on the campus in 2015. There are essentially 5 buildings that exist today, and we're going through a what we call an adaptive reuse and repurposing of these buildings and bringing these buildings from what has been an office park into a condition where they can be used for clinical research, education, and technology. And what I want to do is just talk a little bit about the exciting things that we're doing with the existing buildings and what that means to the community. So the first is the Inova Shar Cancer Institute. As you can see, this will open in the spring of 2019. We will have both photon radiation, traditional radiation treatment, but also, importantly, proton, which is a much more targeted form of radiation that Dr. Trump can get into more details. But this is the first time in Northern Virginia that we'll have this capability. And it matters because if you get proton radiation, it only kills cancerous cells. It doesn't harm healthful cells. So that's a big deal. We're making about a $100 million investment into proton therapy to have it on this campus to serve the community, those that have cancers where this is an appropriate form of treatment. So that's a big deal. Everyone in our community, every family, as you know, has been touched by cancer. My family's been touched by cancer, like I know many have as well. And to have a first-rate cancer center here, we think is crucial. I've always thought, I've been in this community a long time, that nobody should have to get on a plane or on a train or in a car to go someplace else to get the best cancer treatment in the world. And clearly that's our objective, is to have those capabilities here in the Shar Cancer Institute right here in Fairfax County. So again, that's a clear objective of what we're trying to do. In a couple minutes, I'm going to ask Skip Trump, Dr. Trump, to talk more about the Cancer Institute, and he'll give you more details of all the great things that we're doing. But again, this is really the anchor tenet for this campus is the Cancer Institute, having everything you need: medical oncology, having infusion treatment, radiation treatment, whether proton or photon, a team that's going to work with you if you have cancer. So we think this is just a tremendous asset for our community. The next building is our research building. We call this the Genomics and Bioinformatics Research Institute. It will open in 2019 in the second quarter. The focus of this building, the focus of this institute is on translational research. And this is research that can quickly have an impact, a health impact for patients versus basic research. I like it. That's good. It's a good ringtone. I like it. But translational research that has a real impact immediately for patients as opposed to basic research that asks important questions but can take decades to have implications for patient care. Very importantly, this institute, this is a partnership between Inova, the University of Virginia, and other research universities. And this is something that's very exciting. Any Wahoos in the room? All right, we got a couple in the room. Okay, all right. So the University of Virginia, about 2 years ago, we started having conversations with them about a research partnership on this campus as well as a medical education partnership. And we have agreed to have a medical education program that'll actually be across the street at the Inova Fairfax Medical Campus. And we've also entered into a very important research agreement with them to build out a 220,000 square foot research institute that will support our cancer center next door and also focus on genomics and bioinformatics. And we are really excited to have their presence on this campus. We're really excited by this partnership. As you know, they have an outstanding medical school. They're a leader in medical research, and we're just thrilled that they're going to partner with us on this campus. Also, very importantly, we'll have a partnership with George Mason University, a clinical proteomics partnership. Proteomics is a subset of genomics, and again, an important partner with us. UVA, initially, as I said, they're going to have a 3rd and 4th year medical education program across the street. They're looking to expand that to all 4 years, and they view this campus and our partnership as something that's very strategic to them in the long term. I think when you take a look at the Research Institute, one of the great things about it is its positioning, because on one side we have the Cancer Institute, and just down, and I'll talk more about this in a minute, we have something called the Inova Clinic. So to have a 220,000 square foot research institute focused on the latest advances in medical science and technology next to our Cancer Institute, we think is just a tremendous asset for this campus. Okay, I think we're going to run a video from, so this is a video from Dr. Rick Shannon. Dr. Shannon.
In an extraordinary public-private partnership, Inova and UVA have come together to think about the new phase of discovery, building a new type of biomedical research enterprise focused on the betterment of the human condition. As we speak, the renovations are underway for the Global Genomics and Bioinformatics Research Institute, a first-of-its-kind partnership between Inova and UVA that will light the way toward the exciting future of genomic-related interventions. We are excited that this is the first phase of what will be a multi-phased process that will bring the University of Virginia together with Inova to build a new type of academic enterprise in Northern Virginia. Beyond global genomics and bioinformatics, we hope that this site will become the Virginia equivalent of the Research Triangle, so successful in North Carolina over the last 2 decades. But more than that, we're looking forward to bringing the University of Virginia School of Medicine to the Fairfax campus as the first of what we hope will be many schools at the University of Virginia to relocate a portion of their academic activities to Northern Virginia. This will include our School of Engineering, particularly our computer science and material science programs. It will include our Cutting Edge Data Science Institute, as well as business programs from both the McIntire School of Commerce and the Darden Business School. We hope the School for Continuing and Professional Studies will relocate permanently to the Fairfax site. All of this is about building the Fairfax community to become one of the leading centers for both biomedical research and commercialization of those ideas, combining the best of many fields of endeavor in order to really take better care of our patients. We couldn't have asked for a better partner. The Inova Health System is second to none in its historic contributions to the Commonwealth of Virginia. We think this is only the next step in their storied history, and a particularly important step for the University of Virginia, really going beyond the bounds of Charlottesville for the first time in our 200 years. But the next century is about exciting developments, and those developments will occur in Fairfax. And so, although I can't be with you today, please understand our enormous enthusiasm and our deep commitment to the Inova Center for Personalized Health and beyond. Thank you.
So Dr. Shannon heads the entire health enterprise at the University of Virginia, including the medical school. And you heard him mention research and medical education. And also you might ask, why some other disciplines like engineering? Because they're very much applicable to the health and biomedical research area. So we're excited about their commitment to this campus. We're excited about their commitment to Fairfax County and also to Northern Virginia. So we think they're going to just be an outstanding partner with us on this campus. Okay. So the next building is the Inova Clinic. This will open in the second quarter of 2019. You can see it's right beside the Shar Cancer Institute to its left if you're actually looking out the front door. This is a clinic that will be a specialist and subspecialist clinic. We will have a number of different specialty and subspecialty groups, physician groups there. You think about having a cancer center in the middle. Cancer, as you know, has comorbidities. People have other types of conditions in addition to cancer, so you can go next door to the clinic if you need other types of specialty care, and then we have research on the other side of the institute. So we've really tried to think through the positioning of these assets, having the clinic to one side, the Cancer Institute in the middle, and then research on the other side. And again, we think this is going to be a terribly important asset on this campus to have this clinic located here. Okay? Finally, the Building D, which is across the street, we call this our technology and innovation hub. You know, one of the things that is taking place in healthcare today is what I call the virtualization of care. So care is still done very much person to person, but virtual care and having a virtual healthcare center, this will be located in this building. We also have another university partnership there with Shenandoah University, focused on pharmacy and nursing. It's also where we house what we call our personalized health accelerator. This is something we're doing to try to build an ecosystem of discovery and new innovations to help healthcare, the clinical outcomes, quality, safety, the patient experience, and also importantly, reducing the price of healthcare. So that's an important initiative in this space. And then finally, the building we're in right now, this serves as both a conference center. We've had some of the most brightest men and women from around the world to our conference center in the last year and a half since we opened it up for a number of conferences. Again, focused on personalized health and precision medicine. We will also have our sports medicine and sports performance programs in here, and very importantly, a center for healthy living. Okay. So this one this is when you kind of think in a big picture, you know, what are we trying to do here? Inova is clearly the anchor tenant. We have our clinic, we have the Cancer Institute, we have our joint partnership with UVA and George Mason, the Research Institute, technology, innovation, and medical education. And when you broaden out, you know, we're actually trying to build an ecosystem. And this is what the ecosystem looks like to us. And again, the types of assets that we want to have on this campus. And you can see when you have Inova here, you have a UVA here, that also gives you the opportunity to have other types of partners in the bioscience, life science, pharmaceutical space to build out this ecosystem that allows us to attract really outstanding men and women from around the country and the world to this location. So this is how we think about the bigger picture of the ecosystem we're trying to build here.
It's really about improving cancer care in Northern Virginia, having a single place where patients can come and see experts in the specific cancer that they have, but to do that on this campus where there will be intersections with researchers, entrepreneurs, counselors, nutritionists. I mean, it's a wonderfully synergistic and expansive opportunity.
So it's my privilege now, as to Dr. Skip Trump, if you saw in the little short video, to come up and talk a little bit about what we're doing with the Inova Shar Cancer Institute. Dr. Trump has a really amazing background in cancer care. He is a cancer doctor. He has been providing care to patients for a long time, and we're just thrilled that he joined us a few years ago to lead the Inova Shar Cancer Institute. He's going to come up and speak a little bit about the Institute, then he's going to introduce Dr. John Deacon, who will talk more about our Translational Medicine Institute. Dr. Trump.
Thanks, Todd. Welcome, everyone. It's a real pleasure to be here. As Todd said, I am a doctor. I'm a medical oncologist. I focus on genitourinary cancer, kidney cancer, bladder cancer, prostate cancer, testicular cancer. And I have practiced in large academic National Cancer Institute certified cancer centers my whole career. Hopkins, University of Wisconsin, Duke, And for the 13 years before I came to Inova 3 years ago, I was the CEO of the Roswell Park Cancer Institute, which is a freestanding cancer center in Buffalo, New York. Actually, the first cancer center in the world. And I can talk about that history at another time. But I'd like to tell you a little bit more about myself to illustrate both the terrific progress that's happened in cancer care. Not that I had anything to do with the progress this story will illustrate, but the progress is there nonetheless. But also a story that I hope conveys some of the passion that I have for caring for cancer patients, the special place that I think cancer care has in a medical system, and why I do it and love it every day. This story began in 1973 when I was just a kid as a doctor. I was a resident, and I was rotating on the cancer unit at Hopkins because that's where you went as a resident to learn how to take care of very sick patients. I had no inkling that I would be a cancer doctor, but it was during my time on that cancer unit that I decided that's what I wanted to do. I took care of a young man, 28 years old. He came in on a Thursday evening, diagnosed to have acute leukemia in York, Pennsylvania, was where he was diagnosed. Came down to Baltimore. We did all the appropriate things. He seemed to be in pretty good shape, although obviously acute leukemia is a terrible disease and was even terribler in 1973. But we talked to him and his family about what the plans were, sort of tucked him in for the night about 8:30 or 9 o'clock, and I came in the next morning to make rounds, and the way we did things then, we presented all the new cases to the cancer center director, Dr. Albert Owens, at the time, and then went to the bedside to see the patient. I presented my patient, went to the bedside, and the patient was comatose. He overnight had had a bleed into his brain, actually in the morning. He had been okay at breakfast and shortly thereafter had a bleeding episode in his brain, was comatose, and never woke up. It was the recognition of this sudden event led us to ask the question, or led Dr. Owens to ask us the question that we had missed, and that is that this man had a very unusual kind of leukemia with a very strong disposition to having bleeding and clotting, a kind of leukemia called acute promyelocytic leukemia. As you can tell from the story, in 1973, that was almost a uniformly fatal diagnosis. So the patient's family came in. I don't honestly remember, but you'll see why I'm mentioning this. I talked to his wife, took his wife in to see her late husband, and went on about my business and got trained as an oncologist and was working at Duke in 1991. I got a call on the phone from a man who, as it turns out, was the son of the patient that I had taken care of in 1973. He had tracked me down through the death certificate that I had signed in Baltimore, and he was panicked because at the time he called me, he was the same age as his dad had been when his dad got acute leukemia and died. He had been 8 years old when his father died. I had never met him. And he was panic-stricken. So we talked I think we talked a couple different times for a total probably of a couple hours. I told him that there was very little chance that his leukemia was that his father's leukemia was familial. Very little chance he would get leukemia. I also noted that in 1973, his father's leukemia was hard to treat. In 1991, there were some new treatments that were coming about that looked to induce remission in 40 to 50% of patients with acute promyelocytic leukemia. Some of those treatments were derived from an understanding of the genomes, or at least the genetic structure of those leukemia cells, but we were just beginning to scratch that surface in 1991. Fast forward another 25 years. When I moved to Inova in 2015, I moved in January. In March or April of 2015, I got an email from this same young man who now he's not such a young man anymore, he's now in his early 50s. He lives in Ellicott City, and he had seen me on an advertisement of Inova, remembered me, and again, a long story short, we got together a few months later, had met him, my wife and I met him for breakfast in Ellicott City, the first time I'd ever really met him. But when our communication by email, he had sent me some photos of his dad, his mom and dad, and of himself. And I have those 3 photos in my office to remind me why I do what I do. It also, the other part of the story to illustrate the dramatic progress that's been made is that kind of acute leukemia that this man had in 1973 and didn't survive a day in the hospital is now curable 85 to 90% of the time. So that's just one of many, many stories that illustrate how progress has been made in cancer care. It also illustrates, I hope you recognize, the strong feeling I have for taking good care of cancer patients and providing comprehensive care to patients. That's integrating the support of their family, the top flight medical care for those patients, and that's what we will do at the Inova Schar Cancer Institute. I wasn't at Inova for very long before I realized that there's lots of excellent cancer care in Northern Virginia, but the care is very fragmented. It's very difficult to go to a single location and see a series of specialists in the cancer you have. You can see your radiation oncologist and your medical oncologist and your surgical oncologist if you're willing and able to commute from one office park to another. And we now know, in my opinion, for certain, that when you can deliver coordinated care in one place where all those specialists work together, work with counselors, nutritionists, genetic counselors, have access to scientists who can see them and get inspired, that the outcome is better. We know it's better for patients not to have to travel around, but we also now know that people live longer when they're cared for in that model of localized care, localized in one place, provided by specialists in the disease that you have, in the prostate cancer or breast cancer. And so the model for care of our patients is going to be centered at the Inova Schar Cancer Institute. I'll tell you a little bit more about what will be on this campus, but the other important mission that I am on with the help of a lot of very good people is to try to be sure we expand that model of subspecialty, personalized, interdisciplinary, all the kinds of doctors working together across all the sites where cancer care is provided in the Inova Health System, the Mount Vernon, Alexandria, Fair Oaks, Loudoun, and the Fairfax Medical Campus. This care will occur. Well, you will enter the Inova Schar Cancer Institute through that atrium where the roof is. To the right side of that entryway is a 240,000-foot ambulatory care building. Everything in that building is committed to ambulatory care, outpatient care of patients with cancer. A 56-bay infusion center, a research infusion center, 3 floors of what we are referring to, at least at the current time, as pods, where care will be provided. A pod for genitourinary cancer, where the urologist, the medical oncologist, the surgical oncologist, the life with cancer specialist, the nutritionist, the genetic counselors will come to the patient. Our goal is that doctors walk to their patients, not that patients walk, much less drive around the city to see their doctors. So the focus of care is around the patient. interdisciplinary, subspecialty. We need to establish the appropriate infrastructure. And as Todd has mentioned, we are right next door to a wonderful research building that will focus on translational research and genomics, drug discovery. And so the ability to have the care of patients right adjacent to a laboratory facility is a wonderful opportunity. It's an opportunity that is wonderful in part because the researchers get to see why they're doing the research. I think one of the real advantages of a freestanding cancer center is that the researchers run into patients in the cafeteria. They come to work every day, can see right there why they are working on what they're working. We are designing the laboratory facilities that make it easy for patients with the proper escorts to be able to look into laboratories. We're going to design some places in the new building where blood samples and some preliminary processing of materials can be done so patients understand and the staff and researchers understand that this is about working together to solve the cancer problem. The new construction on the campus, as Todd mentioned, is the radiation oncology and radiology building right behind the multi-specialty clinic. And then, as Todd mentioned, we are building a proton facility, a 2-vault, 2-delivery head facility to deliver proton therapy. That's accelerated particles, and the bunker to house the cyclotron that accelerates those particles is just now being finished. So a terrific opportunity. We will recruit more outstanding physicians and scientists, and I think it will transform this property into a center of excitement, but most of all, a center focused on personal, individualized care of cancer patients, the best we can possibly make it. And I think if you reflect on the progress that's been made, the future is really extremely bright in caring for cancer patients here at the Inova Cancer Institute over the next several years. So I'm excited. I hope you can tell about the opportunity to do it, and it is a great facility. Thank you.
So in the next year, I think a profound new way of treating cancer in the greater Washington, D.C. area is going to happen, where our new cancer center, where we're taking care of patients, where we're doing our clinical research, is sitting right next door to our lab researchers who are trying to discover new therapies and new ways of detecting cancer and treating it, right next to our data scientists, our big data experts who are trying to mine what we know in our health system and in the world to try to understand better patient care. We're going to have a environment here where patients, caregivers, physicians, researchers are in the same place and seeing patients together and making those discoveries together in a way that I don't think most premier universities are able to do right now.
Thank you, Skip, and thank you, Todd, and thank you all for being here. I think, as you can see, we who came here over the last few years are incredibly excited about the possibility and what the vision is and what we've already seen being operationalized. Again, my name is John Deacon. I'm a medical oncologist like Skip. I treat head and neck cancer patients and came to Inova almost 5 years ago from Georgetown University, where I had been for over a decade, heading up their head and neck cancer program. And came here because of what the vision was and what we were doing here in terms of personalized medicine, genomic research, and better cancer care. I've lived in Virginia for 20 years and too often saw patients wanting to go to Baltimore or Houston or New York for their care instead of staying here. You might know that over the next 10 years, there's going to be a rise of 30% more cancer patients in Northern Virginia, in our area here, than we've had, because people are aging, and cancer is oftentimes a disease of aging, and people are moving away, fortunately, and for other reasons that we don't understand. So we need to be ready to take care of our neighbors and family members and friends with the best care here. We've talked a lot about genomics, and I want to give a little bit more meat on those potatoes for you. It's by telling you a story and how we're changing how we treat cancer patients. In the past, we treat cancer patients based on if they have lung cancer or breast cancer or colon cancer. So I had a patient who had head and neck cancer, a rare cancer, salivary gland cancer, who we treated with the standard treatment, surgery followed by radiation. Unfortunately, his cancer came back, which happens to over half of these patients. And when it came back, instead of throwing at him the old poison drugs that we've had for 30 years that don't help these patients very often, I was able to send his tumor for testing to look at what genomics was in his tumor, not general salivary gland tumors, but his tumor. And we actually found a mutation, a gene that was often seen in breast cancer. Unfortunately, these days we have a drug for this, patients who have HER2 positive breast cancer called Herceptin. So I was able, to, for a variety of ways, to get access to that drug for him. And as opposed to him dying within 9 months, which is what happens on average, he lived for over 2.5 years on that medication with very few side effects. He was able to enjoy his family, his friends, his golf game, and retirement. Unfortunately, at some point, his tumor started growing through that new drug. So again, we took his tumor and tested it, and this time it came back with a mutation that we see in melanoma called BRAF. And by that time, fortunately, in 2013, we were able to have a drug that targeted that. So he went on a new targeted therapy based on his tumor, lived for another 2.5 years on that medication with very few side effects, again, improving his golf game along the way. So a patient who would otherwise in the past have died within less than a year, lived for over 6 years on these new targeted therapies. Unfortunately, cancer eventually won. That's our reality, unfortunately, even till today. But he was able to be on medications that we've discovered and genomic-based treatments that provided him an excellent quality of life that he could live with his wife and family for years that we would never have seen before. That's how we're changing things right now. Cancer is an awful disease, but it's one that we are accomplishing more and more success stories like that along the way. When we talk about genomics and cancer, there's two kinds of genomics. There's genes you were born with that dictate your hair color, your height, your disease risk, and your response to medications. And in cancer, we talk about the mutations that are causing one cell to grow into a tumor to become a cancer that we need to treat. And what's exciting about what we're doing here is we're looking at both sides of that coin, both sides of the genomics of disease risk and also of cancer once it starts. Why I came here was to be part of what's called the Inova Translational Medicine Institute, where the former director of the NCI came here, Dr. John Niederhuber, and we've built up a genomic research institute that is focused on translational research, like doing these cancer studies. Interestingly, the group and the institute that we've built actually, instead of focusing on cancer and the end of life, actually turned its sights on looking at the beginning of and the front end of life. So over the last 4 years, we've done extensive studies and research looking at issues like the risk of preterm birth in newborns, and the risk of childhood illnesses like autism and asthma, and the risks in women of diseases like preeclampsia that can be life-threatening during pregnancy, and have added extensive new discoveries that we're now taking even further in terms of understanding the genomics of those early lifetime illnesses and seeing what we can do about them. We've also added extensive capabilities to the babies that are born here at Fairfax Hospital. Over 10,000 babies are born. Unfortunately, too often, many end up in our NICU with genetic aberrations that we don't quite understand, and our next speaker, Dr. Ben Solomon, will speak to that. And we've added our genomic ability to understand those abnormalities and pathologies that these newborns face and trying to understand why they happen and what we can do about them. The last thing, and Todd had referenced this, is we're trying to better treat patients with medications. And this is the field called pharmacogenomics. So it's pharmaceuticals, drugs that we all need to use to treat disease, and genomics, and understanding how we can merge those together to provide better treatments, personalized medicine. We all know, in fact, we might have even personally experienced, a doctor gives you a drug, it doesn't seem to work, or it gives you a drug and it has too many side effects, so you stop taking it. Maybe you don't even tell your doctor you stop taking it because the side effects were too bad. We know more and more these days that some of those differences in efficacy and toxicity are due to genomics. And let me give you one example. Some of you might be on or have your family members on a drug called Plavix or clopidogrel. It's a medicine that's given after a stroke or after a heart attack to prevent your blood vessels from reclotting. Well, based on some good research, about 10 years ago, it was found out that about 1/3 of patients don't benefit from that medication. Their body doesn't turn it in to the active drug, so it doesn't benefit them. Now, the problem with doing that is, or having that as a reality, is patients come in with a heart attack, you want to start the medicine on them right away. You can't wait for 2, 3, 4 weeks for a genetic test to come back from the outside. So what we did here in our Translational Research Institute was set up a STAT test, where someone comes in on the ambulance with a heart attack, goes to our catheterization lab, and we're able to run this genetic test within 1 hour so that when the person has their heart blood vessel opened back up, they need to be on Plavix or not, and we have now other drugs they should be on if Plavix won't help them. And we have the result for the doctor within that hour. We're the first hospital in the country that's done that stat test in a clinical setting to provide the right treatment for that patient in that emergent situation. That's just one example of what we're doing across what we call our MetaMap program. Medicines, our map, and what our genomes help do that. Todd mentioned we're offering it as a standard of care to every baby born at Fairfax Hospital and now the other Inova hospitals. When they're born, the parents are offered this pharmacogenomic test because your genes don't change throughout your lifetime. When you're born, those genes that affect drug efficacy, toxicity don't change. So we believe that that starts at day one, and you should have that test offered to you on day one. We've now deployed a series of other tests to help better understand treating psychiatric disorders, ADHD in children and adolescents, cholesterol drugs like simvastatin, Zocor, and how we can better help physicians make the right drug choice for their patients in those settings, and even offering it direct to consumers if they want these testings done. So those are just some of the examples that we're trying to deploy and make real the promise of genomics that was made when the human genome was decoded 15 years ago. We here, unlike many institutions in the country, are trying to make that reality true for us and our patients and our neighbors and our families and friends. So it's an incredibly exciting time, I think, in terms of making that a reality. And now, as it's envisioned here on this campus, to make that mantra of care, which is how we should be doing things in the 21st century, a reality here in Northern Virginia. So I came here, and many who have come here since, Dr. Trump and others that we've recruited from some of the top places in the country, are coming here based on this vision. And we hope that you share in our enthusiasm for this, and hope to share our journey over the next few years as we make this more and more of a reality for our patients, for our neighbors, for our friends, for our community, so people don't have to travel elsewhere to get this kind of care. So with that, I want to introduce our next speaker, Dr. Ben Solomon, a clinical geneticist, one of the smartest people I've ever met, and one who takes care of our newborns and NICU and patients, and young patients with congenital abnormalities, and help run the science baton in ITMI before we lost him to a neighbor up the street. So, Dr. Solomon.
One of the things I'm really excited about ICPH is the idea that people from all over the Northern Virginia, from the Maryland area, from the DC area, have a place to go to ask these questions, to talk to true experts about this. And what's really cool, and what has been really successful in situations like this, is that you have a place that's directly involved in clinical care. But what really makes it work isn't just that, it's the fact that this is part of the nucleus with research facilities, that you're understanding biologically what's going on with those people, with people doing drug discovery, with people doing all the number crunching and all the computer programming, all the bioinformatics. And so all these things fitting in together ends up being a synergistic model that allows us to bring stuff to the bedside.
I love the purple gloves. You look like an incredible Hulk.
So they made me wear those for the video so I wouldn't disturb everything. But a lot of my employees made fun of me. Thank you. So as you can see, my name's Ben Solomon. I'm the head of a genetics company that's based up in Gaithersburg, Maryland. Has about 600 folks that work there, and we do genetic testing for folks all over the world. And it's a very exciting place, and especially in this day and age where so much is happening in genetics and genomics and precision medicine, it's a great time to be doing it. I also want to mention that I have the great privilege, and often humbling privilege, to be able to see patients here right across the street, mostly babies, as John mentioned, who are known or suspected to have genetic conditions. And so I was just over there this afternoon seeing a couple children in the pediatric ward and in the neonatal intensive care unit. And the idea is that through some of these tools, we can figure out, why does this person have this severe medical problem? One of the people I saw today was a 2-month-old child who's having ongoing seizures that we can't figure out, A, why they're having that, and B, what do we do to treat that child? How do we take better care of that child? So individually, all these genetic conditions are rare, right? They might only affect 1 in 100,000 people, or literally only 1 in a million people. But in aggregate, these are actually very common conditions. About 10% of people in the world, 10% of people in Fairfax County, in the country, have these conditions. And the amazing thing to me, and the amazing thing that goes on here right under John's leadership at the Inova Translational Medicine Institute, is that if we take all these people with these individually rare conditions that as a geneticist, I'm not even sure what to call the condition, 30% of the time we can do a single test where we look at all the genes at once and find an answer. And there are breakthrough discoveries that are happening right at the Inova Translational Medicine Institute right now to figure out for the answers for those patients. And sometimes, to be honest, those answers don't give us a silver bullet. But until these tests were available, the average time, and just think about this, the average time for one of these people to get a diagnosis was 8 years. And you can imagine all the pain and suffering and heartache and going into the hospital to try to get tests to find answers about this that would happen until we could do these kinds of tests. And it's really game-changing, and it's so exciting to be able to sit with a family and be able to explain to them, look, we have the answers now, and we can provide more information for you about what we expect to happen. And sometimes there are treatments. I don't know if you guys have followed the news at all. I follow it, as you can imagine, very carefully about all the stuff that's happening with gene editing and genome therapy. And let me just tell you one story about that, which I think is illustrative. There was a child that was born in Germany who had a really severe, again, individually rare skin disorder. So this is going to sound awful, but the disorder was so bad that the skin actually separated from his body and he wouldn't have been able to live. And the doctors were able to take his own genes, were able to change the gene that had to do with how your skin attaches to your body, give it back to him. And you can see, if you look online about that case, you can see him running on the playground and playing. And there's more and more of the possibilities of this because we can understand what's causing these conditions and then biologically how to change them. And I think that's just a great thing to think about, and gives us, me, when I'm seeing these children here in the neonatal intensive care unit, a lot of hope and excitement for the future. Just a story about that. So unfortunately or not, in my job, I have to travel a lot. I go all over and we work with folks all over. So on Monday, I was up in Boston, and luckily I got out before the big snowstorm. I think they got about 2 feet. But and I was up there talking with folks we work with at Harvard Medical School and Boston Children's Hospital. And we have all these long all-day meetings. In the middle of one of the meetings, one of the physician scientists stood up. He got a phone call, and he had to rush out because a patient was being admitted who had a neurologic condition. And this patient met criteria to be on a clinical trial, where before that was an untreatable condition. And now there was a trial that could be used. And the reason that he had to get up was this was something that he had developed in his lab right across the street. And as you've heard Todd and John and Skip talk about, this idea of the Inova Center for Personalized Health is this idea where we can see patients, we can also develop treatments and do things that are better for the life of the community, of the folks that live right here, and folks who are all over the world who want to come here to get their care. The last thing I'm going to say, and I want to make sure I end because I'm sure you guys have questions for Todd and others, and this is going to be a little controversial, but I'll admit this, is that whether we think this is a good or a bad thing, healthcare is changing a lot. So more and more healthcare is going to be delivered in places that are outpatient settings, and as crazy as it sounds, places where people actually want to go, not just I'm feeling really sick, I got to go to the hospital, I got to go to the doctor. But it's critical to have a place that's going to meet this new healthcare model, and in a way that, as crazy as it sounds again, is pleasant for people to take part of. And I think that's maybe the single reason that I'm most excited about this campus and the Inova Center for Personalized Health to deliver on that model. Thank you.
The Inova Center for Personalized Health is important because it weaves together technology and healthcare, and it improves the patient outcome of our residents, and it helps grow the economy and move forward in the research arena, all of which are great positives.
Yeah, I just mentioned that. That's Bobby Kilberg, who leads the Northern Virginia Technology Council. And one of the really important intersections on this campus is between technology and healthcare, because technology is foundationally enabling to almost everything that we're trying to do in clinical care and research. So there's a great opportunity at the intersection here in Northern Virginia, given the technology strengths that we have. Let me thank Dr. Trump and Dr. Deacon and Dr. Solomon for being here tonight. I know some of you didn't think you were going to get some medical continuing education tonight and have a little fun at that, but I want to thank them. They're really just three of a great group of people that we've been able to attract over the last several years, clinician researchers, the smartest men and women in the world, to come here to Fairfax County, to come here to Northern Virginia to serve our community. And it's a privilege to work with all three of them and so many others within the Inova Health System. So hopefully tonight you've had a chance to sense some of the excitement that we have for what we're doing, the repurposing of these old buildings that were housed by big oil and turning them into really a great opportunity to serve our community. We are really excited about what we're doing with the existing footprint of the campus, and also what we're thinking about long term. I have, some of you may know this, I've been in this community for close to 40 years, and some other folks are with us tonight. Steve Cumby, our former board chair, he's been in the community a long time. And I think I can say, and he can say, and others can say, that we've had the opportunity to not only work with the healthcare system, but be employers for other companies and employ lots of people within our community. And I think we would both say this is probably the single most important thing that I've seen in my lifetime here in Fairfax County in terms of what it means to our community from a health standpoint, what it means, the ability to provide care here without having to get in a car, get on a plane, get in a train and go someplace else to get that health care. So we are really, really excited about not only what this means to Inova, but very importantly what it means to our community, the ability to build a global place and have tremendous leadership in genomics and bioinformatics and cancer care, and the opportunity that means for Fairfax County, for Northern Virginia, for the greater Washington, D.C. area, and also for the Commonwealth of Virginia. It is envisioned as a campus of partnerships, and I talked about the partnership you heard from Dr. Shannon with the University of Virginia, with George Mason University. It's a campus where we envision that we will have patients, doctors, researchers, and innovators that are going to want to come and work here. They're going to come and really work on new discoveries, and again, how we can improve the human condition and provide better care and treatment and hopefully predict and prevent disease for those within our community. There are a few places doing all this in the same location with really this shared purpose, and so we think it is a tremendous opportunity again for Fairfax County and Northern Virginia, and most importantly, what it means to us as people who live in the community, our family members, our friends, our colleagues we work with, and that's really what this is all about. We have, as you know, we have filed a comprehensive plan amendment with Fairfax County that would allow us to, in the long term, over a period of years, expand beyond the current buildings that are here today, and beyond the current footprint, that would create a mixed-use development that really allows people the opportunity to come to heal, to learn, and discover. And again, as Dr. Solomon said, you don't have places like this any longer around the country and the world where it's just purely clinical care, research, and technology. You're trying to build a place where people want to come work. You want to build a place where patients, that are coming onto the campus, it's a healing type of campus and a welcoming type of campus. And that's why we filed the comprehensive plan amendment with Fairfax County to give us the long-term opportunity to build this campus and make it a special place here in Fairfax County, and really a great center, a leading center in the world. The county is going to evaluate our application along with a number of others in the surrounding area. There's going to be a community task force that's going to initiate a process for public input. You can read the proposal itself and keep up with the county's task force that's going to be put in place, and the next steps to the website. I think the website is up there. Yep. This is good. Look, this is going to be an ongoing dialogue. We are important citizens like everybody else here in the community. We work here, we live here, we're neighbors here. This is an ongoing dialogue with the community. We're going to welcome your feedback throughout this entire process as we get going with this comprehensive plan amendment that we filed. You can submit comments through our website at www.inova.org/ICPH. I think it's up there. So again, this is an important dialogue that we look forward to engaging with you and others. We're really excited and pleased that you're here tonight. We're going to close with a short video, and then we'd be glad to take some questions.